I went into residency IM with an open mind, and just doing more work with rheumatology, I realized that I can really help people function with their disease. For example, with rheumatoid arthritis, there were a lot of cases where patients couldn't really, their complaints would be, I can't open a jar because, my hands are swollen. After about a few months, I remember patients coming back and saying, oh, I'm able to use my hands again. And they just had a bright look on their face. So this is something I knew I wanted to do every day. I tried to, at the very first visit, just give patients at least a 2-minute spiel of what they're coming in with and let them just tell their story before we get into the nitty-gritty details. Kind of helps me learn their values a little bit, and also seems like a good starting point. I want to understand their initial symptoms and how they started, and trying to get a whole picture from their background as well as the background of the disease or symptoms they're having. I think that the initial visit is probably the most important. We have a lot of treatments for systemic autoimmune conditions. So for example, rheumatoid arthritis probably has about at least 6 different medicines that we can use. A lot of times it depends on the patient's presentation or how the disease is going, what the disease is affecting. So is it also affecting the lungs, the kidneys? That also plays a role in what medicine we choose, but also the patient's history, previous comorbidities, we have to take into account. A lot of these medications are lifelong. A lot of these medications are pills or injections. So you have to you have to take into account even the patient's values of if they are going to be able to take it at home too. Part of the reason why I wanted to go into medicine and actually just start in internal medicine was because I was longing for those long-term establishments with patients, and being able to follow their progress and just see them get better is pretty much what I was looking for in my career.